Welcome to Word of Mouth, the truth about dentistry, our dental educational series for public. I'm Dr. Kheirieh, Prosthodontist, here with Dr. Najafi Dentist, practicing in San Antonio, Texas. We are here to bring the dental world to your home, answering your unanswered dental questions based on reliable sources. This is a link between you and dental professionals. This is Word of Mouth. Our today episode is on dental implant, focusing on immediate versus delayed implant placement. How soon after extractions can you have dental implant? Is same-day dental implant safe? Is it painful? These are all questions that we're going to answer in our today episode of Word of Mouth with our honorary guest, Dr. Drew.
Dental implants are undoubtedly one of the most important advancements in dentistry over the last 50 years. The question whether the natural tooth can be saved or not, it's another debated topic that we have a separate episode on. But at any times when the natural tooth cannot be saved, saving it is not possible or not advisable for any reasons, dental implant and other replacement options will come into the picture. We have a separate episodes on comparing dental implants with the alternatives such as bridge or partial denture. But today, based on your request, we're gonna focus on the timing of dental implant placements. This is also another question that many patients keep asking us, that why sometimes implants can be done at the same time of extracting the tooth, and sometimes extended healing time or gum grafting, bone grafting needs to be done. Our special guest today is Dr. Howard Drew, my great mentor. I myself have learned a lot practicing next to him, being involved in multiple clinical research and the publications that we have done together. He's a periodontist, professor, and director of implantology department. He's also the vice chair of Department of Periodontics at Rutgers School of Dental Medicine, State University of New Jersey. It's a pleasure having him for this episode. Thank you, Dr. Drew, for joining us.
I want to thank Dr. Kheirieh and Dr. Najafi for welcoming me to Word of Mouth. I've known them for many, many years, and I'm enamored with the way they appreciate dental education and quality dentistry. What I'm hoping to show you today is how important it is to pick the proper team to do your dental work. And by a team, I mean an excellent surgeon, an excellent restorative dentist, and a professional lab person. My name is Howard Drew, and presently I am the Vice Chairman of Periodontics at Rutgers Dental School in New Jersey. I've been a clinical practitioner for almost 40 years. And during that time, I've always been involved in academics. I've had the opportunity to write many, many articles, and they've ranged in topics from periodontal therapy, bone regeneration, lasers, and implant dentistry. I've had Dr. Najafi collaborate with me on several, and I thank him for all the effort he has put in. Today's topic is immediate implants, but more than immediate implants, we're going to talk about timing of dental implants and what is correct for you. There are basically three scenarios for placing implants. Immediate implants are the day the tooth is taken out. An implant is placed in an osteotomy. The osteotomy is a fancy term for the hole, and I hope you'll understand that the extraction socket and the osteotomy are very, very different. The second choice to place the implant is 3 to 8 weeks after the tooth is taken out. In that way, we get soft tissue healing and then the surgeon goes in. And the third time is when the bone is mature. And this takes place after 3 or more months. Okay? Very important for you to realize that it takes a knowledgeable and educated team to decide the proper time for you. Okay? Very, very important to realize that the highest success rate actually occurs when implants are placed in mature bone. But I want you to realize I do believe in implants that are done immediately. But the key is having the correct scenario for success.
Although dental implants are pretty successful these days, but the general belief is that implants can all be done in one day. Unfortunately, the extensive marketing campaigns these days are encouraging it too, even at times misleading the patients on this matter. But the fact is that this is not always true. There are some cases that we can place the implant at the same time of extraction, and some cases that we need to wait more and not rush the biology. The question is not whether we can place the implant immediately at the time of extracting the tooth or not. Many times we can. You're able to do that, but it's not advisable. There are lots of research and studies that have been done on this matter, and we have certain criteria for us as our implant team to consider based on our examination clinically and radiographically, some patient factors, in order for us to decide whether it's advisable and reasonable to think about placing the implant at the same time or better to let it heal for time being. Of course, there's no doubt that immediate implant placements have lots of advantages, including faster healing time, less surgery for you, but at the same time, our concern is to make sure we get the successful results aesthetically and functionally, and make sure that implants stay durable over time. So these are all the factors that we need to consider before deciding on whether immediate implant is the way to go, as they call it, teeth in a day, or the other options.
If you look at the screen now and we look at situation number 1, this is an ideal case to place an immediate implant. Why? If you take the root out atraumatically, you still have excellent bone and excellent gum or gingiva to place it. As you get bone disease, trauma, you start to lose the crest of the bone. If you look at the other cases shown on the top line, these cases are not good scenarios for implants. In these cases, grafting is necessary, healing followed by implant placement. The shape of teeth is important. It can normally be square or triangular, okay? Or their variations. The tissue can also be thick or thin. And this, again, is a major factor. Okay? Your team now will look at smile line. And there's 3 different variations on smile. Many people do not show the gingiva at all. Some just show the tops of their gingiva, and many have what we call a gummy smile. These are critical factors that have to be determined. Dr. Najafi and Dr. Kheirieh will advise you if you're a candidate for an immediate implant. Again, you see the different variations in smile line, everything from a gummy smile line to no seeing of the gingiva at all. Okay? This is just a slide to show you the complexity of the case. When your team looks, they look at a host of factors, like I described: shape of the teeth, smile line. They'll look at your complexion to get color, your hair coloring, all of these factors. This is what an excellent team does for you.
So if your tooth has already been extracted in the past, That is a different scenario. As we talked about, we need to evaluate the foundation that we have, whether we need to build up the foundation more or not, if the site, based on overall and specific factors, if it is a good candidate for implant, and then we'll go from there. But talking about this topic that we have today more specifically is when we have to extract the tooth now. When the tooth needs to be extracted, we have different scenarios. Either, yes, doing the bone grafting, the membrane, making sure we preserve the gum and bone, let it heal, make sure we get good, infection-free, healthy bone and gum in 3-4 months, more or less. Then placing the implant, again, let it heal and submerge under the gum, let it heal for another 3 months, no forces, nothing like that, good oral hygiene, and then eventually the implant crown by our prosthodontist. But the other scenario is that at times, yes, if all the criteria are met, we'll be able to place the implant at the same time of the extraction with simultaneous bone grafting or even sometimes gum grafting if needed. Let everything heal at the same time for 3-4 months, and then eventually the final implant crown, the actual tooth replacement by our prosthodontist or dentist. The other scenario is that, which is gonna be the best scenario, that at times, yes, we'll be able to extract the tooth, place the implant immediately at the same time with simultaneous bone grafting or gum grafting, and at the same time a temporary fixed crown over that implant. So that temporary that our prosthodontist will make for you will be a temporary fixed crown, almost as good as your other teeth. They will look really good, but of course there are certain post-op care that you need to consider during the healing time, and then probably 3-4 months later, gradually changing that to the final crown, the final implant crown. That's going to be the best case scenario, that at times in some patients it will be possible for a single tooth replacement. Yes, there is another scenario, as Dr. Drew talked about, which is the early placement that sometimes will be doing that, or the other scenarios is for multiple extractions, especially full cases, which has its own indications. There is another episode, a separate one on that, whether to talk about, yes, again, at times we'll be able to place all the implants at the time of extraction, or sometimes no, just extracting the teeth, letting them heal with a removable denture, a temporary denture, and then eventually placing the implant and go from there.
Regardless of timing of implant placement, you will go home with a temporary tooth 99% of times. There are several temporary options, from removal to fix, like a temporary partial denture, such as flipper, that has a false tooth attached to it, or Essex retainer, which is a clear plastic retainer, or more advanced, like a resin bonded bridge, or provisional temporary crown, which is fixed and attached to your implant. The last option is good when your implant is secure enough in the bone to support the load and the pressures of your temporary crown. To recap, you will not go home toothless, especially for your front tooth.
Good bone, good tissue, you get good long-term results. Here's a case where we had a lot of good tissue, good implant placement, as we talked about, placed more to the palate, okay, and we end up with an excellent result. Okay. This is still in our practice, and the patient is doing great after over 20 years. Now, people will ask, should I get bone grafting when the tooth needs to come out? And the answer is absolutely. If you look at the top picture, when this tooth was removed and no grafting was done, look at the concavity here. This is all due to the fact that there was no bone regeneration. Just to realize, if you take a tooth out and do not graft, you could basically lose 1/3 to 1/2 of the width of the ridge and potentially close to 2 millimeters in the height of the ridge. If you look at the two pictures below, this is after grafting. Now, grafting can be done if you have this scenario, but it's almost always easier to graft at the time of extraction. We could talk about bone regeneration, but hopefully you'll have me back to discuss that on another day.
Yes, prevention is the key. There's no doubt that the bone grafting at the time of extraction can significantly help preventing the loss of structure at the extraction site. By that, I mean when we extract the tooth, yes, we'll need to do the bone grafting, the membrane, in order to keep and preserve the hard and soft tissue structure at the site for the sake of the replacement options later down the road, or at times simultaneous. On the side note, it's super important to replace the missing tooth as soon as possible. We shouldn't forget there are gonna be structural changes in our face, our mouth, and our smile if we don't replace the tooth, whether it's in the front or in the back. Just because there's no pain, no discomfort in your mouth doesn't mean that everything is in good shape.
After the implant healing phase, which is usually about 3 to 4 months, as Dr. Najafi and Dr. Drew mentioned, will be the final step, the implant crown. Now is the time to replace the temporary prosthesis with the final one. It takes the entire team to make sure the final result, aesthetic, function, will be just like your teeth. This is the collaborations between me as a prosthodontist with your implant surgeon, either periodontist or oral surgeon, to make sure we'll get the good result.
As Dr. Arnie Weisgold always say, we need to visualize the end result of our treatment from day one. So for me as the implant surgeon, tomorrow morning when I'm seeing my patient, I need to do my best visualizing how the tooth replacement will look like down the road. So not only considering all the patient factors, examining the area, but also collaborating with the other team members, with my prosthodontist, restorative dentist, in order to make sure that the implant that I'm placing during the surgery serves as a good foundation for the final tooth replacement, aesthetically and functionally.
Many patients have asked if these implant procedures are painful. And truthfully, they are not. Why are they not painful? The reason being is these are elective procedures. We are doing these procedures on patients that are not severely medically compromised, and their healing will be okay. The other reason is we never want to go into an area when there is infection present. If you're going into healthy bone, healthy soft tissue, my patients are usually very surprised how little discomfort happens after these procedures are complete. I usually tell them they can resume normal work the following day, and usually for discomfort, pain can be handled with just over-the-counter medications. So again, if you're healthy and there's no infections, you should expect minimal to no discomfort.
Another question that we received from you is on whether it's safe to get the implant done at the same time of extraction all in one day or not. The concept of tooth in a day, whether it's a single one or multiple implant on the patients that for some reason they are losing all their teeth. Yes, it is safe if it is indicated. As we talked about, Dr. Drew, Dr. Kheirieh, there are certain criteria that for us as the implant team we need to consider before deciding whether we recommend placing the implant at the same time or it's better to wait for a couple of months and then place the implant later down the road. So these are multiple factors that us as your implant team need to talk to you in details after our examinations, of course, and then finalize it with you.
So in concluding, always remember, grafting is normal, socket anatomy must be evaluated, shape of teeth is important, adjacent restorations may be necessary, and we need a team approach. People ask, is it worth it? Absolutely, it's worth it. And if you have a good team, then they'll make sure you have a satisfactory temporary prosthesis through the whole cycle. Even if it takes 6 months to 9 months, my answer, is it worth it, is emphatically yes. Again, I want to thank Dr. Kheirieh and Dr. Najafi for inviting me to partake in word of mouth. It has been a privilege and an honor to be here today. And I leave you with be safe, be healthy, and enjoy your implants. Thank you very much.